Thank you for taking the time to join us today as we talk about doulas, pregnancy, and maternal mental health. So today we're going to be talking a little bit about histories of doulas as well as postpartum depression and the whole birthing care and everything like that.
Right now, come here, you. Pronounce calling you. Up, up. Say that one more time, please.
Thank you for taking the time to join us today as we talk about this very important topic. You know, historically, there have been many gaps in care for pregnant women before conception, during, and after birth. And it seems as if doulas are a growing trend, which we know that's not really the case because birth attendants have always been around. But before we get more into the history of doulas and their pivotal role in pregnancy and childbirth, tell us a little bit more about yourself.
Well, thank you for having me. And as you said, my name is Victoria Viard, and I established Life Doula Services about 2 years ago. Just inspired by a family situation that occurred and a conversation with a friend who she said you should be a doula, and when she said that, it resonated so true to me that I immediately like that night started looking into how to become a doula, because I had already known what one was, but maybe just never considered it for myself until someone spoke it out, and it just was what I decided I'd start pursuing, because I had a full-time job working as a supervisor with children in middle school, but this is something completely different and very foundational to be there for women during birth and postpartum, and help be a part of that experience. Like, it was something I was passionate about and wanted to pursue. So a year ago, Life Doula Services, I established the name and brand and started working, and have had experiences with about 6 families to date, and I'm hoping to continue that, especially this summer with things lifting in terms of more freedom to move around. Hopefully families will be more open and inviting for their services. So
Nice. So, what exactly is a doula?
a doula, the word itself is Greek, and the way to define that word is a woman who serves, or a female servant. So that is what has just been attached or synonymous with the kind of care that has been provided for generations by someone in your community or your village, wherever you're from. I think we can all maybe think of someone who we knew of or had heard about that was always on call whenever someone was going to have a baby. But formally, a doula, is someone trained and experienced, a professional to provide the physical, emotional, and informational support for women during their pre-pregnancy, postpartum period.
Okay. Do men become doulas?
There are a few actually that have gone to trainings and are providing doula services. Maybe not very prevalent, but there are male doulas. Yes, absolutely. It is a field that, like nursing care and being a teacher, isn't something just solely a woman, could provide. Men for sure can become doulas as well. Yes.
Well, I don't know how many women would prefer a man, but it's good to know that men are entering what would be considered women's roles. So
Right.
how do you become a doula?
Um, I chose to look up, what organizations there were that provided training for becoming a doula, and found DONA International trainings for both birth and postpartum doula training. So they are who I am certifying with.
Okay.
Yes.
Well,
And sorry, just to say that there are different organizations that one could choose that meets their needs, because DONA was in person. I chose them. There are online ways to become certified, just like remotely. You don't have to attend a workshop or training in person. You could just go online. And so just selecting a organization based off of what best meets your needs, or your budget in terms of what you're willing to invest in cost.
okay, nice. It's good to have both options for people who work odd jobs, odd hours, or just want that flexibility. So,
Definitely.
so what services do doulas provide?
There's a range of services that a doula itself can provide, but when you think of it, I think most women think for birth and just being maybe there um, during your birth and labor, but you can have a doula service you during your postpartum or antepartum. Like, for example, a woman who's high risk and is bedbound or needing to be on bed rest for however many weeks up until their due date, they can have a doula provide services and care during that time. So there's antenatal, there's of course for birth, there's postpartum, and then you have other specialty doulas for stillbirth, because maybe the families are women that need support after they've lost a baby, miscarriage, or even just through the process of infertility and those types of things. There are death doulas that are for families who it doesn't have to do with baby, but have lost a loved one and need support. So then insert doula, and they're, again, the range of services that doula can provide. But what I provide is birth and postpartum services currently.
Wow, I did not know that. I
Yes.
had no idea that there were death doulas, and
Yes.
there was a specific category for those dealing with stillbirth.
Yes, absolutely. There's an organization that trains you specifically for providing care for women who have experienced stillbirth, because whether it's current situation that they're dealing with, or moving forward into conceiving and having another child, just dealing with the emotions and feelings from that, they go through extensive training. There's a site called Stillbirth Day, and they're training doulas to provide care specifically for women who have gone through a stillbirth.
It takes a special set of people to enter those type of roles. I remember fondly lots of experiences of me having to go tell patients that you're no longer pregnant, or even catching the products of conception because it was randomly expelled right there in the ER.
Wow.
And she didn't even know she was pregnant. She was like 20 weeks. She didn't even look pregnant. She was very skinny too. Very, very skinny, no belly at all. And it's never easy, especially for someone who wanted their child and they were trying. It's never easy.
Right.
How do you all deal with that?
It's good to know that then there's doulas that can be referred, called upon, and say, hey, there's someone you could talk to that could help support you during this time.
But how do you deal with that personally?
I have to say it's a challenge to not carry over certain traumas as even a doula that you experience with different clients into your next family that you're working with, and not have it be in the back of your mind a trauma that you help support a family through carry over into the next family. So doulas need support as well, and so it's important that other doulas network and have other doula friends and people that they can just call. And I think it's that community that, you know, they're the only ones that maybe would really be able to relate is another doula, because we know how we work and that intimate setting and how difficult some cases can be. So yeah, doulas definitely need their support and network as well for those challenging cases, definitely.
You brought up a very good point. You know, it is important for any healthcare professional to know how to separate and compartmentalize work and different experiences from another, because if you don't learn to process it, it definitely will wear you down. And that's why a lot of people who seem fine end up, you know, addicted or committing suicide or doing something out of the norm because they never had an outlet to release all those energies.
Mm-hmm.
You know, it's something, especially with COVID, that's being shown to be very prevalent in the healthcare community, that we all need someone to reach out to, and we need positive and healthy coping mechanisms.
Definitely.
So, what is the difference between a doula and a midwife?
Well, for a midwife, when choosing, you know, okay, I'm pregnant, I'm going to, you know, go to my gynecologist and OB hospital that route, or selecting a midwife for your care, you know, the difference between midwife and doula is the clinical aspect. Nothing of what a doula does is clinical. We don't check temperature, blood pressure, prescribe, medicate. None of those things are we responsible for. That would be out of our scope of practice to do anything clinical in terms of caring for the woman. Whereas when you have your midwife there, they can do these things, and they are the ones that are really on top of all of your medical history and what that means in terms of caring for you and delivering, or, you know, helping assist in birthing a baby. That's what a midwife would do. A doula wouldn't. You know, we're never gonna say, oh, don't worry, the doula is not here. The midwife, sorry, isn't here. I can do it. I can help. No, that's out of our scope of practice. So that essentially is the main difference. And so in terms of like working together, sometimes people confuse the two and, you know, think it's synonymous, like doula and midwife, we do the same thing, but we absolutely don't, you know, because when you think of a midwife who is there to help you more often than not, it's for a natural birth or home birth setting or birth center. You have your midwife there, and they're focused on making sure you're getting what you need and getting the baby out. Whereas the doula is there for the mom. So the care does not switch and go to the baby after the baby is born. The care remains strictly focused on the mom. The doula is there for the mother throughout the entire process. And once the baby comes, a lot of that attention with the partner and other medical staff switches over to baby to care and check for them. The focus never leaves the mother for doula. So that's a big difference there when you think of not having a doula for your natural birth. Like a midwife can't really do everything. They support you in your natural, you know, they have techniques, they know things they can tell you, but it's hard to continue that support after the baby's born or during that process.
And you did a fantastic job explaining that moms are only cared about during the pregnancy. As soon as that literally as soon as that baby is born, everyone who's there from the family and friends, oh, let me see the baby, let me see the baby.
Right.
No one cares about the mom anymore.
A doula does. That is who they are there for, absolutely.
Even in the postpartum world, which is, I'm a strong advocate for a stronger postpartum care, because you only get one visit after, and not all persons go back for that visit. You had a whole 9-10 months of follow-ups and checkups, and ranging from
weekly visits,
once a month to weekly visits, or even more, depending on how complicated your pregnancy is. So it is very important in what you do. And thank you for defining that distinguishing difference between a midwife and a doula.
Yeah.
So
there's a term we like to use, doulas. It's mothering the mother. So we're not replacing a mother figure, no. But that is the idea or general thought behind how we look to care for the mother, is caring for them. Because everybody else, like we established, will focus and switch their, concern for, oh, how's baby? No, we're thinking about mom.
Okay. So is there any difference with moms giving birth in the hospital setting versus home births or a birthing center in terms of your scope of practice?
It's important to find a doula that will support your needs and what your plan is for birth, because it can vary in situations, even change from, and there's some doulas that, from however many years of experience they've had, would maybe choose a certain setting only, home birth only, home birth birthing center only, and not a hospital, or vice versa, maybe a doula who would only support you in a hospital setting. And that's their choice as individual, care providers in their business and what have you, that, you look to find one that would match what it is that you had in mind for your birth and support you. Generally speaking, a doula will support you in any setting, whether it's home, birthing center, or hospital, like myself. Doesn't matter for me personally where the mom would choose to have baby, whether it's the hospital, the home, or the birthing center. I would be there for support. And so it's just based off of their needs, their comfortability, their situation in terms of risk factors, because I'd like to remind people who aren't expecting and have no idea about birth work, that having a baby isn't an emergency. So to automatically default and assume that, having your baby in a hospital is the safest choice isn't fair to say for expecting mom who is healthy and has no high risk or, complications. They can choose to have their baby at home and not be safe, and choose to have their baby in a birthing center and not be safe. Choose to have their baby in a hospital and not be safe. So it really is determined by the family and what their needs are.
How would you say doula services have differ between the 80s and 90s versus today?
I think when we look at the past and where you would insert a doula when families chose doula services, I don't think that there was a heightened awareness of what a doula was to medical personnel, the staffing, the hospitals, and I would even dare say that it wasn't welcomed and not as inviting in those settings. Opposite from midwife practices and those home births and childbirthing centers who, know how essential having a doula for the birthing person at the time is, that it is welcomed and is invited and, encouraged even. And a lot of times those facilities work together with doulas and invite them or introduce them to families for their birth way back when, right? And the hospital settings, I don't think were as open even today, depending on where you're located geographically. Hospitals aren't very keen on having a doula present during a woman's birth, because what ideas they have and the way they want to help encourage a more of a natural process sometimes conflicts with their agenda and timeline and interventions and what they maybe had in mind to do. So there's that conflict that you still see depending on where you're located, right? With the prevalence of doula services, like New York has always been on the up and up, and for years have had good working relationships with doulas and hospitals, even providing them nonprofit, pro bono, and finding caseworkers, finding doulas for families of low income in those neighborhoods to give them that kind of support. So there's those working relationships that you see in different parts of the U.S. and here in Florida, I think it's becoming more prevalent to see doulas with families in hospitals, and there are still some hospitals that we learn or know of that don't welcome a doula being present during that time. So it's an ongoing battle to allow families and women to choose to have support persons there for their birth that are trained, that are educated, that want to see the best outcome for the family, meaning, less interventions and that sort of thing. And so, again, there's that conflict with doctors and healthcare providers that we don't always see eye to eye on what the goal should be. So there's a lot of advocacy work going on, and even today finding insurance coverage where certified doulas can be covered, or that could be an expense paid by insurance providers, which is something that is now where it wasn't before back in the early 80s.
So insurances will now cover doula services? Is it all insurances, some, and about how much?
There are some, like, for example, from what I understood here in the state of Florida, there's maybe one, and I don't know if it has processed or gone through yet or been approved in terms of an insurance company, or I believe Sunshine. I don't want to say for a fact that they are covering the cost for families who choose a doula, but it is something that is being worked on in terms of policies that are allowing that coverage. And again, it's a lot of pre-qualifiers and qualifying situations of, okay, well, is the doula certified and who with, if in terms of whether or not they allow the coverage for the service. So it's in the works. So it's promising and something that families, can say, oh, wow, great, I can choose a doula and it's going to be covered by my insurance, whereas, 30 years ago, that wasn't a consideration at all, because it's something like the preventative care and all that kind of thing.
That's awesome, because, maternal mortality is really becoming a huge issue, especially in the minority population, especially Blacks.
Right.
But for the cost of services, for those who do not have coverage or their insurance does not cover it, is the service affordable? And if so, what are the expected costs of doula services?
There's a range, and it can be affordable, absolutely. I don't for a second want any family who is considering inviting a doula into their, birth situation, postpartum care, is something unattainable. Like, it's only for the rich. That is such a farce and completely untrue. There are many doulas who, you know, are working towards certification like myself. So when you're looking at the stages for a doula in terms of their career and practice, they're at different places. So the cost and what they would charge varies. And in terms of affordability, you know, there's some that, you know, against what a business person would advise would, you know, do it for free because we need hours for certifying, meaning we need to work to become certified. So that's a situation that you could find with a doula if you do your research and look through the database. Like DoulaNet is one that I put my information on. You find so many doulas in your particular city, your locality, to provide services, and the range again varies. There's a sliding scale working with families low income and what doulas would charge to meet their needs. And so yeah, you can have a cost of zero for someone who is like, I'll work with you, I want to become certified, do you want to work with me? Like, it's a mutual decision that they would make, but that can happen for a family. Now, if you're wanting somebody with a lot more experience in years of practice and working, then you pay, right? And it's only fair to say that, you know, the cost attributed to someone who is so experienced, it matches, because you don't want to undervalue or undercut what the services are once you are aware of what they are and what it entails, you know. So how the doula sets their price, it can range. And so on the high end for something like a birth, $1,200. On the low end for someone who just wants something of a stipend to cover certain expenses like the gas and commuting that it took for them to get there, $150, right? And that's, a birth can last however many hours, right? But we're talking about what a doula may charge for their services for that particular period. And when it comes to postpartum, a lot of times you look at more of an hourly rate, because a family just may need, you know, what we recommend is no less than 10 hours of postpartum services, and you can spread that out to be 2 to 3 visits postpartum by a doula. They can, on the low end, charge 15 an hour, on the high end, charge 40. Now, when we look at the high end, that doula may also be a lactation consultant, may, you know, be able to provide the breastfeeding support more. So, like, I can provide breastfeeding support. Doulas do that. But when it comes to, like, the actual difficulties and problems diagnosing, you know, what, you get a specialist, and you might have a doula who's also that. So then the cost for the doula services, along with the other certification that they have, is what is attributed to the higher end, right? Yeah, there's so many other things that a doula can do for the client outside of what a doula does that would be attributed to the cost that they charge, or the fee that they set. But it is affordable, absolutely.
Yeah, so it's basically on a case by case, and definitely doula by doula service.
Yeah, and it's an investment in care that, you know, a family should consider, just like they, you know, go and make purchases for cribs and car seats. You know, that's an investment for safety when you get. So something of a doula is that sort of investment that should be considered for, at the very least. And family members could gift the services to you. You could put that on your registry, is something we like to suggest, like at a baby shower, say, I'm going to gift you a postpartum doula. That is a great gift to have, something that most families don't think about, but would be something that really may meet the very practical needs of a family postpartum.
Yeah, that's actually a good idea. I wouldn't have thought about that myself.
Yeah.
And with the closing of so many baby stores like Babies R Us, you know, People are no longer really going into the store to create registries. They're doing online through Walmart, Target, or wherever. So that would be nice to put on your registry. So are doulas more accepted or used by certain cultures, generations, certain regions of the nation?
I would assume at this time, yes, because of, like, I am aware of like the prevalence in states like New York and even California, and how a lot of people again attribute these kind of services to wealthy. So, you know, when you are well off and you think of, oh, you know, I'm going to have a baby, and you want the best of the best, you know, services and that kind of care, doula comes into play. And a lot of more affluent families might by default be able to afford and choose that kind of care. So, and it becomes one of those things too, where, you know, what are you educated about? You know, what kind of research have you done? And you know, unfortunately, minority groups don't usually have access to all the resources that there are for them to even know what a doula is or consider having one. So then they're left out of what care they could have, you know, what
Mm-hmm.
services they could be provided, not based off of their, you know, color, their ethnicity, their nationality. None of those things are a consideration for someone who wants to provide care to an expecting mom. So a doula is there for you and you don't even know it. So that happens a lot, unfortunately, in the underserved communities, that they're just not aware that the services are there, and are affordable and could be provided to them. So it leaves a group of the most high need out for those reasons.
What
So
about,
a platform like this is super important to share
mhm,
with families.
okay. What about Caribbean nationals? Are they using doula services?
My clients have been Caribbean. And
Mm-hmm.
so I say that to say I'm living in South Florida. That's kind of just the general population of people, demographic, first generation, you know, from whatever respective Caribbean island. And so that's good. And, you know, encourages me that, you know, there are families who are of Caribbean descent who do choose, you know of resources like doula services and invite them for their birth. But yeah, I think it just becomes, with the family dynamic, a struggle for Caribbean families who, you know, feel like that's an imposition to have somebody, you know, of an outsider invited to your very intimate, you know, family setting, your home life and your birth, right? It's a super intimate time. So you might have mom or grandma question why, right? Why
Mm-hmm.
would you choose somebody there for you for that? They might say, I can do it. I can be your constant support person. I can massage your back throughout the whole duration of your labor. They might, you know, say that they're there for that, but um, a lot of times it's difficult to see your loved ones in pain. It's difficult
Mm-hmm.
to know how to compose yourself when things are happening, and having a doula who's kind of objective and not attaching themselves in that way can really do what they're set to do for the mom and provide that constant care without a range of emotions kind of impeding that, because that it's supposed to be a kept sacred space. And a lot of family members, Caribbean family members, might not fully be aware of their presence and how it can affect that dynamic. If you show a look of worry in your mom, you're the mother watching your child go through, that affects the mom. Insert a doula and they kind of are there to help blockade that and like help redirect a focus for the mother not to feel that energy, because it changes things. It can slow down labor, stress, and all these other, comments and, oh, do this, do that, and, it's not respective of what they want. Yeah, it's something that it just needs to be more of an open mind that Caribbean families have to doula services.
Yes, to change the mindset will take some time, but hopefully the services will grow and flourish within the Caribbean diaspora. All right. Well, thank you so much again. And I hope you all learned something from today's episode. Talk to you next time.
Thank you for listening to today's Life as We Know It podcast. Remember, life is what you make it, so be sure to live it fully every day. Also, if you'd like to hear more of our topics or stay up to date with us, go ahead and subscribe to our channel and get notified each time a new video is added.